My name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफ़ी फर्क आ रहा है.
Okay. I actually had this surgery in the back and you said I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Bangalore. And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
Speech. You are able to speak words properly and sentences properly.
Just you try to say something.
Treatment the same day. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar, Voice Therapist, and we are live at our YouTube channel SLP Sanjay Kumar, Voice Therapist, and today I am not in Bangalore, I am out of station, but I wanted to start this live and continue the therapy. So here with us is Harish, and Harish is having some voice problem. He is not in India and I am in India, but not in Bangalore at my clinic. But we have planned to continue the therapy online in spite of the distance. So नमस्कार दोस्तों, आज हमारे साथ हरीश नायर जी हैं और इनको वॉइस की समस्या है और आप सभी का हमारे यूट्यूब चैनल पे स्वागत है. और आज डेट है 16 अगस्त 2021 और आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं और भविष्य में हम लोग ट्रीटमेंट के बाद भी लाइव होंगे. तो आप हरीश नायर का पोस्ट ट्रीटमेंट वीडियो जरूर देखिए. तो friends, we are live today before treatment and today date is 16th of August 2021 and in the future we are going to be post treatment live. So please subscribe our YouTube channel and don't forget to watch post treatment live of Harish Nair. Harish Nair, say about your, unmute your mic, say about yourself and your problem, why you contacted me. Just we are live at YouTube. Continue.
Okay. Hi, my name is Harish Nair. I'm 18 years old. I'm KL, Malaysia. And yeah, so for the past 5 years, I have been going through some high pitch problem and voice breaks. So I thought of contacting Dr. Sanjay Kumar because I'm going for treatments and therapies before, but nothing happened so far.
Okay.
So I'm looking from better treatment.
How long you tried treatment at your place? What was the duration of treatment?
So far it was for 5 years, 3 times a year.
Okay, so you tried 5 years, but don't worry, you are in touch with the right person, right professionals.
Yes.
Will correct your problem. Don't worry. At our center, we have seen the most common duration during online treatment is 2 weeks. When we give offline treatment, I have seen 8 days is more common. But again, I will be telling this health science is not a mathematics. 2 plus 2 is although not always 4. So there can be plus minus, and the list we have treated in 1 day also in some cases. But for online treatment, 2 weeks is very common. Okay. And what are the challenges you have faced or you are facing due to this voice problem? Can you tell us?
Due to this voice problem, I've been facing challenges like it has been very hard for me to make presentations in class, school, and then maybe in the phone, some people mistakenly call me, yeah, madam and all. And then I cannot speak loudly sometimes. Yeah.
Okay. Okay, thank you so much for your faith, and we'll also talk about why this problem occurs. Sorry, my mic is mute. I'm going to also talk about why this problem occurs and some other voice disorder and what we are going to do in the online therapy. So those who are watching this live, please be connected with us and we'll discuss like what are the reason of such kind of problem and what exactly we are going to do in the voice therapy. To understand why this problem occurs, let's first understand the normal speech production mechanism. For normal speech production, first thing is the thoughts. Okay, that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put a air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cord start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. For example, if you want to say the, tongue is coming between the teeth. When you want to say back up, the tongue is getting elevated. So each and every sound has own place, own manner of articulation. So when we say a one sentence, there are so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sounds generate, we modify that sound into different sound. And in one sentence, there are so many words. In each word, there are so many sounds. Each sound has own place, own manner of articulation. So speech production is a quite complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, fluency goes. So that will be reflecting in the case of stammering. If place of articulation, manner of articulation will be wrong, there will be pronunciation problem. For example, if you want to say the, tongue should come between the teeth and you are not putting your tongue between the teeth, so their sound will be something different. So now we'll be coming to the problem what Harish is having. So Harish's voice is a high-pitched voice, feminine, or we can say the shrill voice and childish voice. So this can be happen due to so many reasons, like if the nature has not given sufficient mass and the length of the vocal cord, the problem we call sulcus vocal is, in that case also the pitch can be higher. And even I have seen, but these are very rare cases. If there will be hormonal issue, testosterone issue, then also pitch can be higher. If there is a phonatory gap, in that cases also some cases we have seen the high pitch voice. And but now we'll be talking about specific Harish Nair case, because already we have done the assessment and we found that based on the acoustic analysis and some other findings, he's not having sulcus vocalis, he's not having phonatory gap, his vocal cords are normal. And then also why his pitch is higher. So why this happened? During puberty, mass and the length of the vocal cord increases due to a hormone called testosterone. So if mass and the length of the vocal cord will increase, pitch reduces. Because I told here is we have larynx, inside the larynx we have two string like structures known as vocal cords. So during puberty, mass of the vocal cord, length of the vocal cord will increase, then pitch reduces. You have seen in the guitar, thin string produces high pitch voice, thick string produces low pitch voice. So before puberty, there is no much difference between boy or girl's voice, because they are having the same kind of vocal cords almost. But during puberty, in case of boys, mass of the vocal cord, length of the vocal cord increases due to a hormone called testosterone. So if mass and the length will increase, the pitch reduces. You have seen in the guitar, thin string produces high pitch voice, thick string produces the low pitch voice. So before puberty, the vocal cord behaved like a thin string of a guitar, but after puberty, because of testosterone hormone effect, it will become thick and it will start behaving like a thick string of guitar. But some kids or some boys like you, during puberty, mass of the vocal cord will increase, length will increase, but they will not shift to the new voice. To maintain their childish voice, they will, instead of vibrating whole mass and the whole length of the vocal cord, they will just vibrate thin edges of the vocal cords. So once you vibrate only thin edges, it means vocal cord is behaving like a thin string of a guitar. But actually it is a thick string of a guitar. So when guitar string will be behaving like a thin string, then the pitch will be higher. So as a voice therapist, what I will do, I will try to stimulate whole mass and the whole length of the vocal cord, what you have to vibrate during your voice production and speech production. So once whole mass and the whole length will be stimulated, the vocal cord, actually it is a thick but behaving like a thin string of a guitar. Now it will start behaving like a thick string of a guitar. So thick string of guitar means what? Low pitch voice. So I'm very much confident and optimistic Harish Nair will be having low pitch voice in the future. And those who are watching this live, please subscribe our YouTube channel and don't forget to watch Harish Nair's post-treatment live. And those who are new to our channel, for them information is, my name is Sanjay Kumar, and you can say SLP Sanjay Kumar. SLP word is for Speech Language Pathologist Sanjay Kumar. I love to people if say SLP because I'm a speech language pathologist. So, and I have studied from AIIMS Delhi, All India Institute of Medical Science, New Delhi. From there, I did my graduation in the speech and hearing science, and post-graduation I have done from the University of Mysore in the field of speech language pathology. And my area of interest is treating voice disorders. So by profession, I'm a speech language pathologist and audiologist both, but I love to treat the voice disorder. And with us today in the live, Harish Nair is here, and Harish Nair is not in India, he is in different country. And of course, my center is in Bangalore, but today I'm not in Bangalore, I am somewhere outstation. But still, Harish is so much motivated, and I'm also motivated to work. So we have managed to work in some village I have. So today I'm in some village. Okay. So thank you everyone for joining us and watching us, and we'll discuss now any questions are there. So before discussing the question, I want Harish, you should speak about yourself and your problem once, and then I'll come to the question answer session.
Okay. Again, my name is Harish Nair, and my problem, as said before, I have high pitch, and and also sometimes I have voice breaks. So what happens is this causes me to have difficulty in presentation, speaking loud, and some people assume me as female, and that kind of stuff.
Okay, and I'll take the questions. If any questions are there, we'll keep discussing. So Jagdeep Jadeja D has joined. Thanks Jadeja for joining and watching us. And Hemant Kumar is also is here. Thanks Hemant for joining us and watching us. And Arnav Ghosh is here. Thanks Arnav for joining us and watching us. And now we'll discuss question answer. Okay, and Hemant Kumar has mentioned stammering. I think Harish, you can switch off the. And Hemant Kumar, your voice is coming. Sorry. Hemant, don't play right now. That recording is means don't play. I think you are playing that. That is also going in the live. Don't play that live. What we are doing that because that sound was going. Okay.
Yeah.
No problem. So you can mute your mic. Okay.
Yeah.
Yeah. So Hemant Kumar has mentioned he's having the stammering. So Hemant, by speech therapy, we have seen some improvement in case of stammering also. So you can contact us and we'll guide you. And now the Arnav Ghosh is here. Arnav Ghosh has mentioned, sir, what is the fee for a stammering problem? Arnav Ghosh, you can call us, we'll do the detailed evaluation, and then we will be able to comment on the fee structure and other detail, because we have seen sometime patient will say that he has a stammering, and when we do the evaluation, we find he is having pronunciation problem, and sometime patient will having pronunciation problem and they will be saying he is having the stammering problem. So it will create confusion among the patients. So better you can call us and we'll do the detailed evaluation, and then we'll accordingly will guide you. And sometime based on the perceptual evaluation also comment, but it depends. And our contact details are in this description of this live also. And thank you everyone for joining us and watching us. And today with us is Harish Nair. Harish Nair is not in India. I'm in India, but not in Bangalore. I'm out of station in some village. Okay, and but Harish is having so much motivation to start the therapy, and I also am motivated. So we thought let's start. So Harish, again, you can tell about your problem, why you contacted me. Unmute your mic.
Okay. Hi, my name is Harish Nair, and I feel like I have puberphonia due to high pitch, and also this problem causes me to face difficulties in presentation, speaking out loud. I have voice breaks, and some people mistaken me for being a female in the phone. So this is something I really wanted to fix with Dr. Sanjay Kumar.
Okay. What's your age, Harish? What is your age?
Yes.
What is your age? How old are you?
Oh, I'm 18 years old.
Yeah. So puberphonia word technically we use when the patient comes to our center during puberty. So puberphonia means a voice problem which occurs during puberty. But now your age is 18, so you are not a pubertal age. So technically somehow it is correct, but totally technically it's not correct. Because you are not at pubertal age. So I love to tell like a high pitch voice, feminine voice, shrill voice, girlish voice, like that. But technical term puberphonia, I'll be a little bit not be using. The reason is you are not at the age of puberty. Puberty age is what?
Yeah.
What is puberty age?
Puberty age around 13 to 15.
Yeah, roughly it's correct. But now you are 18,
Yes.
so we can't say it's exactly the pubertal age. So puberphonia word is not technically correct, but somehow sometimes people use, but technically it's not correct completely. Okay, and yeah, so because Harish is having high pitch voice problem, and we'll be correcting by online voice therapy. So what we are going to do in the online voice therapy? So as I told, why this problem occurs, like during puberty, mass and the length of the vocal cord increases, pitch reduces. So during puberty, his vocal cord mass and the length has increased, but he is not using whole mass and the whole length to vibrate during the voice production. So he's using only thin edges of the vocal cord. So if you are using thin edges of the vocal cord actually it is a thick, but behaving like a thin string of a guitar. So when guitar string will be thin, the pitch will be higher. So what I will do as a voice therapist, I will stimulate whole mass and the whole length of the vocal cord, and once whole mass and the whole length of the vocal cord will be stimulated, pitch will reduce. So I'm very much confident I'll be able to help him, help Harish Nair, and we are today before treatment live, and in the future we are going to be post treatment live. So please subscribe our YouTube channel and don't forget to watch his post treatment live. So दोस्तों भविष्य में हम लोग हरीश नायर जी का पोस्ट ट्रीटमेंट लाइव भी करेंगे, तो आप लोग इनका पोस्ट ट्रीटमेंट लाइव जरूर देखिए, और इसके लिए आप हमारे यूट्यूब चैनल को सब्सक्राइब कर लीजिए। और आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं, आज डेट है 16 अगस्त 2021, और भविष्य में हम लोग ट्रीटमेंट के बाद लाइव होंगे। मैं हूँ इंडिया में, भारत में हूँ, और हरीश नायर जो है वो डिफरेंट कंट्री में, इंडिया में नहीं है। और अब मैं आता हूँ फिर क्वेश्चन पे, अगर कुछ क्वेश्चन्स होंगे तो उस पर भी डिस्कस करते थे। हाँ, एक क्वेश्चन दिख रहा है यहाँ पे, क्वेश्चन है कि सर आई एम फ्रॉम कर्नाटका, शिवमोगा, सर ನನಗೆ स्टैमरिंग प्रॉब्लम ಇದೆ. So Prashna, you can contact us, and our contact details are in the description of this live, and we'll be helping you. At present I am out of station, but I'll be working online, and once I'll reach Bangalore, either you can come to the clinic or you can take online therapy at this moment also. So I came to some village for personal reason, but I'm working. And thank you everyone for joining us and watching us, and those who have joined new, for them information is like we are pre-treatment live with the Harish Nair. Harish Nair is not in India, and I'm in India, and we are before treatment live, and the future we are going to be post treatment live. Harish Nair, can you tell once again where you are, what exactly problem you are facing, if you have taken any treatment, when you took treatment, how long you took, and so that people can listen your voice.
Yeah. Hi, my name is Harish Nair. I'm 18 years old. I'm from Kuala Lumpur, Malaysia. So I have had high pitched voice since I was 13 years old. I started therapy as well when I was 13 years old. So now it marks 5 years since I've been for therapy. I went for therapy 3 times a year. And yeah, my voice is still high pitched. So with this high pitch problem, I face issues such as unable to do presentations properly. Some people can't hear me in the mic. I can't shout loudly. Some people mistaken me for a female in the phone. Yeah, and those stuff.
So thanks for Harris. Thanks for your faith on us. Can you hear me?
Yes.
Yeah. So thanks for your faith. In spite of being in different country, you have shown faith on us, and I'm confident I'll be able to correct your problem. Sometimes awareness is lagging, so that sometimes people take more time. But in my clinic, I have seen during online treatment, 2 weeks are very common, and in rare case we have treated in 1 day also. But when I give offline treatment, then I have seen 8 days are very common. 8 days are very common. So I'm thinking within 2 weeks, or you should get your better voice, or maybe little plus minus, because I again say that health science is not exactly mathematics 2 plus 2 is equal to 4, but I'm expecting 2 weeks, but it can be a little earlier we can correct, or little later. Okay. And I'm coming to the questions. There are people, those who are saying some questions. Ulvar is saying hi, sir. Hi, Ulvar. Thank you so much, everyone, for joining us, and thank you so much. And those who have joined newly, the information is we are live with Harish Nair. I'm live with Harish Nair. Harish Nair is not in India, and he's having high-pitched voice, feminine voice, shrill voice. And today we are before treatment live. In the future, we are going to be post-treatment live. So please subscribe our YouTube channel and don't forget to watch his post-treatment live. And whenever you have any communication problem, always you take voice therapy from a professional. Professional means those who have the valid degree in the speech language pathology field for the better result. Sometime wrong way of doing vocal exercise, sometime wrong vocal exercise means your voice and the vocal cords. And then how you'll be knowing who is certified? Suppose if you are in India, so you can find very easily. Those will be speech language pathologists and speech therapists. They will mention their degree where they have studied, but those will be healthcare quacks. They will never mention from where they have studied and which year they passed, from which college they passed. And but the professional will mention all this information, and the professional will also mention they are registered in the Rehabilitation Council of India or not. If they have registered, what is the registration number? So you can make out difference, because of sometime unemployment, there may be some healthcare quacks. They will also write with their social media pages, speech therapist, SLP, voice therapist, audiologist. So make sure that you are taking help from a right professional having valid degree in the field, because sometime wrong way of treating some communication disorder may damage the voice vocal cord, or if you are contacting with the healthcare quacks, audiologist may damage your hearing also, because sometimes if they are providing hearing aid machine and there is over amplification, that may damage the hair cells of the cochlea. So you should be very careful while choosing your healthcare professional, and nowadays you can do the research about the professional's degree and all. Then only you should take the speech therapy or audiological services. And for those who have joined newly and those who are new at our YouTube channel, about me, I have studied from AIIMS Delhi, All India Institute of Medical Science, New Delhi. There I did my graduation in speech and hearing science. Post-graduation I did from University of Mysore in the field of speech language pathology, and my area of interest is treating voice disorder. So once you explore our YouTube channel more in details, especially our YouTube channel's playlist, you'll get an idea like what kind of communication disorder we treat at our center and what could be the expected result, what could be the durations. I will suggest everyone, those who are watching this live, so please refer our YouTube channel's playlist. And once you'll explore our YouTube channel playlist, you'll find different communication disorder playlist. For example, you will find the playlist for the people having vocal cord paralysis and their pre and post treatment videos. people having the stammering, and we have given a speech therapy. So pre and post treatment videos like spasmodic dysphonia pre and post treatment videos, functional aphonia pre and post treatment videos you'll find in our YouTube channel playlist, sulcus vocalis pre and post treatment videos, misarticulation pre and post treatment videos, and even aphasia. It's a language disorder which occurs after the strokes, pre and post treatment videos. So that will help you to understand, like a certified speech language pathologist, how helps to the people having communication disorder. And in fact, I'm a speech language pathologist and audiologist. So I do hearing evaluation. I dispense hearing aids also. So once you explore our YouTube channel, so you'll also find a playlist. Like once we have feeded the hearing aid to the patient and how his communication improves. So that kind of videos also will be able to find out. So please explore our YouTube channel playlist and try to understand how a certified speech pathologist and audiologist changes the people's life by managing their communication problem or treating their communication problem. And there is one question. Ulawar is saying, मेरा voice change कर सकते हैं? My age 38. So it's a very good question, Ulawar, because you have mentioned the 38 years age. So sometimes people get scared because their age is higher, their age is, so they will not be treated. But at our center, we have treated highest age 55 years. So, and in fact, the change was very good and it was quite impressive. So once you explore our YouTube channel playlist, you will be able to find a 55 years age guy pre and post video, or I'll put that link in this live also. So that will give you an idea like how a certified speech pathologist changes the life of people having the different communication disorder. In spite of the age, we do the pitch and the loudness correction. So don't worry about your problem in the age. So please contact us. We'll do the perceptual evaluation. If needed, we'll suggest certain tests. And after that, we'll be able to guide what we can do, we can treat or not, or it will be offline or online, then expected duration, cost, etc. will discuss. And Binayak Halayal is saying, मेरे को हिंदी इंग्लिश नहीं आती है, क्या करेगा? अच्छा तो I don't know then which language I should speak. You have not mentioned which language you know, Binayak, so no problem. And so thank you everyone for joining us and watching us. Thank you so much. Thank you all. Love you all. Now we'll stop this live. But before that, again, I'll suggest Harish Nair. When you tell about your problem, why you contacted us, unmute your mic.
Hi, my name is Harish Nair. I'm 18 years old. I'm from Kuala Lumpur, Malaysia. So my problem is I've had high-pitched voice since I was 18 years old. And I went for therapy here locally in Malaysia for the past 5 years since I was 18 years old. I think around three times a year. And nothing has changed so far. Not so much. So yeah, I'm coming here with the help of Dr. Sanjay Kumar with better words.
Okay. Yeah, in fact, you are in different country, I'm in different country, but in spite of that, we'll be helping to you and we'll be solving your voice problem. So thank you, Haris, for helping me to being in live to create awareness among people, and not people from India, all over the world. Like this kind of treatment can occur, and in fact we can treat online, and what the result online therapy can give. So we are trying to create awareness and you helped me, so I'm very happy for you. But once we'll treat, I'll become complete the treatment, I'll be more happy. Okay, so thank you all and for watching. Thank you so much everyone, and thank you Harish so much. We'll stop this live now.
Thank you.
Thank you.